we will talk about the exogenous pigmentations. As I told, it is defined as a pigmentation which arises as a result of the introduction of metals or drugs into the body via mucous membrane, intestinal tract and skin. So exogenous pigmentations can be also classified into three: accidental pigmentation, iatrogenic pigmentation and heavy metal pigmentation. Accidental pigmentation include accident during childhood. For example, if one falls on road, some particles of the road surface gets embedded in gingiva and if not removed may cause discoloration. Next is charcoal tooth powder, graphite tattoos, etc. can cause accidental pigmentation of the oral mucosa. Next one is iatrogenic pigmentation. This includes amalgam tattoo. It is also called as localized argyrosis. Dental amalgam tattoos are relatively common intraoral pigmented lesions with an estimated incidence of 8%. It is characterized by the deposition of restorative debris composed of a mixture of silver, mercury, tin, zinc and copper in the subepithelial connective tissue. The most common sites for amalgam tattoo are on gingiva and alveolar mucosa. It can occur at any age, but it is rarely seen below the 12 years as amalgam restorations are not used before the age of 12 years. Females are more affected commonly than the males in a ratio of 1.8:1. It is described as a flat macule or sometimes slightly raised lesion with margins being well defined or diffuse in other. Pigmentation is blue-black in color. It may gradually increase in size. Next, we will talk about the pigmentation due to drugs and metals. The first one coming under this category is bismuthism. It is a systemic metallic intoxication due to bismuth compound. The pigmentation is produced by the action of hydrogen sulfide on the bismuth compound. The hydrogen sulfide is formed through the bacterial degradation of organic material of food retention. The symptoms of bismuthism include vague gastrointestinal tract disturbances, nausea, bloody diarrhea, bismuth grip and jaundice. Sometimes, in the long bone, white bands of increased density appear in the ends of diaphyses immediately adjacent to the epiphyseal lines. This is called as bismuth line. The oral manifestations include the patient may complain of a metallic taste, increased salivation with burning sensation in the oral cavity. Ulcerative gingivostomatitis is a very common occurrence in bismuth poisoning. Blue-black bismuth line appears to be well demarcated to eye on gingival papillae. An important point under this is a paper test. It will indicate whether the pigmentation is actually in the gingival tissue. If the pigmentation persists, when the small piece of white paper is inserted into the gingival sulcus, the presence of pigmented area is verified. The management of bismuthism include removal of the cause, oral hygiene maintenance, topical anesthetics, and so on. Next pigmentation of the oral mucosa is plumbism or lead poisoning. The oral manifestations include there is a metallic taste which is accompanied by excessive salivation and dysphagia. When the exposure to lead is very high and oral hygiene is very poor, a line known as Burtonian line is seen which is grey-black in color and is present along the gingival margin. The management of plumbism include the use of chelating agents. Lead can be removed from the body by using a chelating agent such as EDTA, but nowadays other chelating agents like DMSA and DMPS can also be used. The next one under the exogenous pigmentation is mercurialism. It is also called as the pink disease. The etiological reasons include the medicinal use of mercury, the mercury in dental amalgam, the mercury in paint, mercurial diuretics, night creams, etc. The oral manifestations include there is a marked increase in inflow of ROPY VISCID saliva. This will cause trembling. The patient may experience itching sensation and metallic taste in the oral cavity. Mastication is difficult due to pain. The gingiva becomes extremely sensitive or painful and it may exhibit ulceration. The tongue is enlarged, painful and ulcerated. The lips are dry, cracked and swollen. Sound teeth may exfoliate and one or more teeth may be found on the bed in the morning as patients awake. The management include supportive measurements like bed rest and suitable dietary regimen, control of salivary flow, and chelating agents. The next category under the exogenous pigmentation is silver poisoning. It is also called as argyrosis, which occurs due to chronic exposure to silver compound. The etiology include the medicinal use, the use of photographic films, occupational exposure to silver, etc. The oral manifestations include the pigmentation is distributed diffusely throughout the gingival and mucosal tissue. There is slate blue silver line along the gingival margins. The oral mucosa exhibits a diffuse bluish black discoloration. The next one is arsenism. It occurs due to arsenic poisoning. The etiology include industrial exposure to arsenic, medicinal use of arsenic, which is used to treat asthma and dermatose such as psoriasis. The oral manifestations of arsenism include oral tissues that are extremely painful and the patient may complain of excessive salivation. There is severe gingivitis where the gingiva become intensively inflamed. There is necrotizing ulcerative stomatitis. Tissues are deep red in color. The next one under the exogenous pigmentation is gold poisoning. It is also called as Auric stomatitis. The etiology include the medicinal use of gold, which is used for the treatment of rheumatoid arthritis, lupus erythematosus, and leprosy. The oral manifestations include the patient gets metallic taste in the oral cavity before the development of stomatitis. The stomatitis is the most common complaint of the patient who is receiving gold therapy. Vesiculation and ulcerations of the oral mucosa can be also seen. It includes buccal mucosa, lateral border of the trunk, palate, and pharynx. There are pigmentations caused by other metals like copper, chromium, and zinc. The oral manifestation of copper pigmentation is Clapton line, which is bluish green in color. For chromium, it is deep orange color, and for zinc, it is bluish gray line. So, the pigmentation is both normal and abnormal discoloration of the oral mucous membrane. Pigmentation has multifactorial etiology. Most of the pigmentation is physiologic, but sometimes it can be a precursor of severe diseases. So, it is important for the practitioner to identify the cause of any pigmentation presented in front of him. So, that is the end of my today's topic. I hope all of you found it useful and interesting. Thank you.